and welcome to United Hospital. Thank you everyone for joining us today's live webinar, and the subject that we are going to touch today is breast reduction. To start with, I would also like to tell you that today is World Plastic Surgery Day, and congratulations to you. With us we have Dr. Keertana Devasani, who's a consultant plastic surgeon at United Hospital. Welcome, ma'am.
Thank you, ma'am.
So to start with, let's begin with our first question. What are the common plastic surgeries, procedures that are done on the breast, doctor?
Okay, so plastic surgery is used to treat various problems of the breast.
Okay.
It could be either to enhance the appearance or to deal with certain diseases in the breast. The most common procedures done are firstly breast augmentation, wherein if a woman is not happy with the size of her breast, we can augment it or increase it to the size of her liking. This can be done either with implants, silicone implants, or using the patient's own body fat. The second common surgery done is breast reduction surgery, wherein an abnormally large breast, which is troubling the patient in various ways, can be reduced and the breast can be reshaped and recontoured to a shape of the patient's liking. Thirdly, some women also suffer from sagging of the breasts, wherein they don't have a problem with the volume, but rather with the shape, and that it's excessively sagging. In these patients, we advise the surgery called mastopexy or breast lift, wherein the shape of the breast is lifted up.
Okay.
Other than this, there are certain diseases in the breast, like there are some benign tumors called fibroadenomas, which are very common in younger females. And these need to be removed if they are growing in size, or if they are painful or causing symptoms. So these tumors are removed by plastic surgeons in using better scars, using hidden scars, and sometimes the scars are not visible at all. Also, women who go through breast cancer and have had to get their breast removed to get rid of the cancer, can also undergo breast reconstruction, and there are various techniques to do this. Lastly, there's a condition called nipple inversion, wherein the nipple is inverted rather than being protruded, and this makes breastfeeding very difficult. So this is also a problem that is addressed by plastic surgeons.
Thank you so much for this. But today we are going to concentrate on breast reduction as the topic of the hour. So my next question to you would be, how is this surgery done and how long does it take?
Firstly, I would like to tell you who is the ideal candidate to undergo this kind of surgery. So Indian women as such are endowed with bigger breasts, what we observe. But sometimes the breast can be abnormally large. So there are two sets of patients in whom we generally see this. The first is the younger females, who could be late teenagers or in their early 20s. So during growth, what happens is the breast has receptors which respond to the female hormones, estrogen, and increase in size during puberty. But sometimes these receptors can be oversensitive, so they react excessively to the normal estrogen levels in the body, and they abnormally increase in size. This condition is called macromastia, or in more severe cases it is called gigantomastia. Other than this, generalized obesity can also cause a proportional increase in the size of the breast. And another set of patients is those who have undergone multiple pregnancies and have breastfed their children. And breastfeeding generally leads to hypertrophy or increase in size of the breast. And in some women, it does not come back to its original size and remains bigger. So this kind of problem can be pretty debilitating for these women because the excess weight on the chest can cause a lot of back pain, neck pain, shoulder pain, and social embarrassment, and these women are unable to wear clothes of their choice. They cannot wear tight clothes, they cannot wear t-shirts, and their wardrobe becomes very restricted. So this causes some amount of psychological depression in these women. Other than this, because of the heavy breast, the broad straps at the shoulder tend to cut into the skin just because of the sheer weight, and they leave very bad bruises and marks on the shoulders. And also because of the heaviness in the underbreast area, there is a constant accumulation of sweat and grime, which can lead to repeated fungal infections in the under breast areas. So these are the common symptoms that we see these women present with. A lot of women actually go through this, but they're not aware that this is a condition called macromastia, and there is a solution available.
It is
for
treatable.
This. Yes.
So these are the candidates. And what is the percentage of these young girls?
Who would
the
present with
teenagers?
this?
Yes.
I do
On
not
an
know the
average.
exact percentage, but probably around 5%, I would say, of
Okay.
teenage girls do go through this.
Do go through
Yes,
this.
yes.
So what is the entire surgery process? How does it look like? How
Okay.
long does it take?
So this breast reduction surgery is called reduction mammoplasty in technical terms. Wherein some amount of the breast, including the skin and the breast tissue, the parenchyma that we call, is reduced, and we first discuss with the patient to what size they would want to come.
Right.
But it's not, it has to be realistic. I mean, everything is not possible, but we have a discussion on what would be safely possible and what would be aesthetic for that patient's body habitus,
Okay.
for their height and build. Following this discussion, this surgery is done under general anesthesia, and it takes about 3 to 4 hours. Both the breasts take around 3 to 4 hours. And the patient generally stays, I prefer to keep my patients overnight for observation, but sometimes the patient goes home on the same night also.
Oh, okay.
Yes. Other than that, yeah, I think that would be it.
Okay.
About the
So
surgical
it could be
procedure.
a day procedure.
It can be a day procedure.
Until
If
and
it's
unless
done early in the
required.
morning and we have enough time to observe the patient, then it could be a daycare procedure also.
Okay,
Yes.
that's wonderful to know, because
Yeah.
the assumption is if it's a surgery, then you have to stay about a day or
yes,
2
yes.
days before you are discharged. This is good to know, doctor.
Yes,
Thank you
yeah.
so much. Does a patient leave with any scar on her
Yes,
body?
yes, definitely. This surgery does leave behind scars. It is not a scarless procedure. The most common scar that is left behind, it's called a lollipop scar, just because it is shaped like a lollipop.
Okay.
So there is a circular scar around the areola, which is placed in the dark skin of the areola. So that part of the scar is not really visible. It's hidden. We hide it in the areola. The rest of the scar is one straight line which goes down from the lower part of areola all the way to the undersurface of the breast.
Okay.
So these are the scars generally the patient is left with. If we do a procedure called a vertical scar breast reduction, there's also another kind of surgery which we reserve for slightly heavier breasts when we need a massive reduction in size. That surgery is considered slightly safer in some select situations.
Okay.
So that gives an inverted T-shaped scar, meaning along with the straight line scar, there is also a horizontal scar that runs along the undersurface of the
Undersurface.
breast. So the only visible portion actually is the vertical scar, which is also on the lower half of the breast. So there is a scar, but it's not really on the very obvious or visible portions. And we advise several regimens and scar reduction treatments later to make it as light as possible. Yes. But a scar is there, and scars always remain, but they can be made better with time.
Better with
Yes,
time.
yes,
Yes. What is the downtime for recovery?
Okay, so after this surgery, there would be some pain and discomfort for the first 3
Obviously,
to 4
yes.
days. Yeah, for which we prescribe pain medications. After the first 3 to 4 days, if the patient has a desk job that can be done from home, they can resume it in 3 to 4 days.
Okay.
To get back to regular household activity or to go to office, probably a week of rest can be advised. Other than this, to get back to heavy physical work or back to the gym and exercises, we would advise at least 6 weeks of a gap. But pretty much if you're working from home, around 3 to 4 days is what is required.
Is good
Yes,
enough for
yes,
time.
yes.
So, which is also again very nice to know that recovery is faster.
Yes, it is a
Okay.
fast recovery.
Are there any post-operative precautions that
Yes,
a woman
yes,
has to take?
definitely. So the woman has to wear a tight brassiere. Generally, we recommend a sports bra because giving proper support to
Is
the
very
newly
important.
shaped breast
Yes.
is very important, mainly to maintain the shape, the new shape of the breast,
Correct.
and to relieve pain, to relieve swelling. So the support is extremely important. So the sports bra must be worn at least for a month, day and night. That's what we advise. And further precautions include avoiding lifting very heavy weights in the early recovery period, and to avoid any kind of trauma or any injury to the breast. Other than this, to make the scar better, as I said, in the post-operative period, there are certain things that we advise. So it could be a gel, it could be ointments, it could be silicone sheets, which help in making the scar better with time.
And these depend on what kind of surgery they have undergone?
No, whatever surgery it is, these are scar treatments.
Okay.
So whatever scar they are left behind with, we advise certain things to make the scar look better.
Okay.
So this is something the patient would have to do for some period of time following the surgery to get a better scar.
Right.
Yes.
Right. Are there any kind of complications during the surgery?
Yeah, there is no surgery that is
Without
devoid of
complications,
complications. Yes. So most commonly, the most common complication would be a seroma or a hematoma, which means accumulation of some amount of fluid in the wound. But to prevent this, we leave drains, which are basically tubes which are kept inside the wound and which come out of the body, and which remain for around 48 hours. So this takes care of any collection that is expected and that happens post-surgery. This is the most common complication that we see. Other than this, there can be an altered nipple sensation. The patient may feel some decrease in the amount of sensitivity of the nipple. But what we have noticed is this is very rarely permanent. It is a temporary thing that some women notice.
Just during recovery
time, yes. And even if they do encounter this, it generally recovers by itself over a period of months. So it's very rarely permanent.
Okay. Yes. So post-surgery, are the results extremely visible?
Yes, definitely. I mean, the reduction is immediately visible. The weight that the woman loses off her chest is it's very immediate. It's drastic. But I would like to say that the final shape and the contour. So basically, this is not just a volume reduction. This is also a reshaping and recontouring of the breast. We have to bring back a saggy, excessively large breast to a very aesthetically pleasing shape and size.
Right.
So this final pleasing size that we aim for, this takes some time for the shape to finally settle down. So probably I would say in a month to 6 weeks, the patient can finally appreciate the good contour that they have got.
Okay. But the reduction is visible.
The reduction is immediately visible, yes.
And that is, I think, even wearing the sports bra for a month more than that helps.
Yes, that helps that helps with the result. It helps in getting the good shape. Yes.
Okay. What surgeries can breast reductions be combined with?
Okay. So sometimes we combine breast reduction with liposuction in the chest area. So if a woman is also overweight, along with hypertrophy of the breast, she may have some extra fat on the sides of the chest or in the arms. And if the woman wants an overall well-contoured torso, the overall look of the torso has to change and become slimmer, then we combine this with liposuction of the sides of the chest.
Okay.
Yes, so along with this reduction in the size of the breast, there is also an overall change and a more pleasing contour given to the upper half of the body. Other than this, there is something called a mommy makeover, which means a woman wants to get back her body to its pre-pregnancy state as much as possible. So this procedure entails many things. Breast reduction or breast lift sometimes, and not a reduction, is a part of it.
Right.
And other parts of this makeover could be liposuction and an abdominoplasty, wherein excess sagging skin of the abdomen is removed and a better contour of the abdomen is given.
And what is the recovery period if all these are
that
done
is
together?
Definitely longer. That's a major undertaking. And some surgeons do not prefer to do everything at the same time and would rather do it in a stage procedures. Yes.
Okay. How does undergoing this surgery affect the patient or the lifestyle?
The lifestyle, I think there's a drastic change in the lifestyle. Everything that they've been going through from so long, all the social embarrassment, unable to lose weight. I mean, they cannot even kickstart their weight loss journey because they're unable to exercise and unable to run or jog or even walk sometimes. So in this way, there is a drastic change in the woman's day-to-day life, day-to-day activities. Even simple things like getting household works done becomes much easier. They can wear the clothes of their choice. They can be more confident in their social life or even self-confidence. So in all these ways, it's very gratifying for the patient. Patients are generally very, very happy post this procedure.
I can imagine that. I can imagine that. You also mentioned that about 5% of the women who undergo this surgery are the young generation girls, the teenage or around their 20s.
Correct.
So, will this surgery affect them after they become mothers for breastfeeding?
Okay. So, what we need to there is no clear-cut answer to this. It's not a yes or a no.
Okay.
What we need to understand is when we are doing a breast reduction, we are basically removing some part of the breast, but the part that remains is untouched, and the part that remains, the milk ducts in it are intact. We are not interfering with the milk duct pathways of the breast that remains. So that is functional, and that should function like a normal breast. So generally, if you go according to statistics, then it is said that around 50 to 60% of women who undergo this procedure are able to breastfeed. Which is also a similar percentage in normal women. Even in normal women, 100% of them cannot breastfeed for various reasons. Breastfeeding is a very complex phenomenon. There are many factors in play there. So there are several reasons why breastfeeding can or cannot happen. So even if it does not, we would not know if this surgery is the only reason she's not able to breastfeed. Yeah. But the rates are around 60% if you look at statistics. And I have seen in my experience, patients do breastfeed. Commonly, the amount of volume they say is a bit less than what they would expect. But other than that, I think women can breastfeed post this. Yes.
Okay. So I think we have covered most of the topic, of breast reduction. And we have Dr. Keertana Devasani consulting at United Hospital. So if any women you know or you yourself would like to consult her, please do give us a call, take an appointment, and we'll always be here to take care of all the necessary things for you. Thank you so much for spending an afternoon with us. And you too. Please do join us next time also. Thank you so much. Namaste.